Hi, everyone, and welcome back. Feeling kind of emotional. It's been 3 years, 3 years with this podcast. And the whole time, my mission has been to really stay truthful to bringing guests that I believe in, topics that I believe are important to you, the listener. Never rushed out episodes just to have one. Said no to countless guests. I feel like there is a lot of information out there, and I've wanted to do something really special. And oh gosh, life is changing a lot. I'm going to talk about that in my next episode, but I'm really glad to bring this episode to you. This is really what it comes down to, and why this feels great to bring you on our 3-year anniversary. This episode is about kindness and human connection. Today I have on Dr. Kelli Harding, and she aims to make the world a kinder and healthier place for all. She's an expert in psychiatry, mind body medicine, and public health. She teaches at Columbia University in New York City, and she's also the author of the critically acclaimed book, The Rabbit Effect: Live Longer, Happier, and Healthier with the Groundbreaking Science of Kindness. I really want you to get this book. Dr. Harding has appeared on Today, Good Morning America, BBC, New York Times, Oprah Magazine she's been in. I mean, she's all over the place. I'm very touched and honored that she took the time to sit down with me and with all of you. She's got a challenge for you at the end, so make sure you listen till the end. And I want us to bring some kindness back toward her. She's giving so much to the world. Her research is going to help make change in how we do things in medicine. I really believe that. So, and we can all be a part of that with her. I rarely ask anything of my listeners, so I'm going to go for it with this episode. I'm going to ask you to really take her challenge and her research and to advocate. Um, Other things about Kelli: she was a 3-time speaker at the World Happiness Summit. In 2023, she co-founded Our Kind of Club, a global community that promotes positive social connections with the science of kindness. In 2024, she co-founded NeuroParent Alliance for caregivers of neurodivergent teens and young adults. She lives in New York City with her husband, 3 sons, and their rescue dog. And I wanted to be there with her. You can find her at kellihardingmd.com. And we're going to, of course, link all her stuff in the show notes. Friends, the challenge is to listen, take this in, and to do something. Do something. Here we go. Welcome, Dr. Kelli Harding. Thank you so much for being here.
Oh, my pleasure. I'm so delighted. Thank you.
I love that you're in New York City. I miss New York City. I'm up in the Catskill Mountains.
Oh, gosh, I know it's always the trade-offs, right? And the nature that you have is really priceless.
Yeah, no, the nature is great. Sometimes I miss the energy. Actually, I'm headed your way later today just to
Okay.
get a little of the buzz, a little of the creative buzz, and the learning that comes from there. And here today, of course, we're here to talk about your learning journey and research and into this world of kindness and the health benefits of kindness. Um, I wonder if you'd take us kind of back to the beginning, or a little bit of how this became your focus.
Oh, absolutely. So I'm a physician, a medical doctor, and uh, I got really interested. I went to med school with this idea that I wanted to help people live healthier lives, and so I learned everything I could in the books. And when I got to the wards and met the patients, I was really surprised because there were a lot of um, sort of curiosities, like patients who you would think that they would get better from their diagnoses and prognoses, and then they would really struggle. And then the opposite of that, where you'd really see people thrive despite really serious illnesses. And I just trying to put it together, like what was happening became sort of my mission in medicine. And the good news is I figured it out.
Wow.
Or a good part of it. So there's still much more of the mystery to be solved.
So give us the cure.
Sure. So, so many iterations later, I thought initially it had to do with was sort of the mind body connection. So I studied that, and then
Yeah.
it still didn't quite feel like enough. And so I started actually a fellowship that they have at Columbia looking, it was primarily looking at medically unexplained symptoms. So, people who are not feeling and functioning well, but we can't quite figure out what's going on. Oftentimes like the lab work looks okay. The imaging turns out fine, but we can't quite put it together because something is
Yeah.
happening serious in someone's life. And so that fellowship really actually catapulted me to the next phase of trying to understand this, which is all the decades of data from public health that shows how our social world impacts our health and well-being. And of course it does, right? So I heard you sigh when I said that. So I have
Uh,
a feeling that
yeah.
struck a chord.
It hit so much. I'm just thinking about, I was thinking about the book on loneliness and how that, impacts our well-being. I'm thinking about people in my life who have, recently serious, illnesses that are unexplained.
Mm, yeah.
And I guess one of the questions that was coming to mind is like, how often did you see that, that just like this must have been calling out to you quite a lot, that there's a lot that's not explained that you're seeing in front of you.
Yeah, absolutely. And it was every day. I mean, that's the thing as a clinician, when you talk to other clinicians, they get it. They see this too, sort of these medical mysteries, what's happening there. So it became this quest to try to better understand that. And the most shocking thing for me was just that when you look at the data, it turns out, our social world, we always have thought like the body, maybe diet, exercise, the genes, like, those things matter. And of course, they are important. But it turns out by far the vast majority of our health is directed by our social world. And so that includes what's happening in our homes, our workplaces, our schools, our communities, and greater society at large. So
Mm,
um, it was so eye-opening that I had to write an entire book about it actually, because it felt
yeah.
like we had to get the word out, because this isn't something that just, you go to the doctor and they address. It's the kind of thing that, every single one of us can make changes in our lives and the lives of the people we care about to make things better for one another. So and it really comes down to kindness. So that's why I just had to do what I can to shout from the mountaintops that we have to treat each other better.
Oh my gosh, I'm so excited to get this message out there and to understand the research a little more deeply and help our listeners understand. This is really big because kindness is free.
Yeah,
Some of these other changes might not be. I love to break this down a little more. I liked how you were starting to break down like the different ecosystems.
right.
So like the family hub, then we've got like the school or the work, then we've
Mhm.
got like the greater society, maybe our community, maybe the state or the nation that we live in. Can you talk a little bit about these different spheres of influence?
Sure. So this was just the way that I came up with to try to organize it. And it's somewhat based on the biopsychosocial model of medicine, sort of thinking about,
That's what I was thinking.
where
Yeah.
you as the individual fit into this bigger ecosystem. And I think what's really remarkable about this is in the past we sort of thought it was one directional, right? Like the person is impacting all these areas. But then now, thanks to fields like epigenetics, we understand that in fact the social world is actually impacting our biology as well, changing physiology, which is remarkable. And that's not how, most of us initially learned how the human body worked or how bodies worked
Oh
in
my
general. And it's
gosh.
really, in a way, it's really beautiful because it means we're all really interconnected in this way that we had not appreciated before. And once you see that, you understand, we can make changes for one another. So that was sort of the reason for the breakdown. So I broke it down by these systems because otherwise it's just too overwhelming.
Yeah.
So I figured it was a way to kind of like think about, okay, like what's in my sphere of control that I can make a difference, both in my health and well-being and the health and well-being of the people around me. So if you like, we could dive into some of those areas if that sounds fun.
Oh, I would love that. Yes.
Okay, terrific. So just sort of starting like where you live. So this is thinking about who's in your home with you, and that's partly your self care and your peace that you find there. And we were talking earlier about nature. Like, are you surrounded by nature? Are you surrounded by positive energy of all the things like we are here in Manhattan? What's going on around you, and we can't always control what's happening in the world, but sometimes we can make little changes to help control what's happening in our lives. So probably the easiest one is thinking about our relationships with the people that are in our homes with us. So whether that's a family, a partner, a pet, children, even a plant, it turns out can make a difference when it comes to, I have
Mm.
my plant back here. And the idea is that, when we are not only cared for, but taking care of other people, that can make a real impact on our health. And the hope is that things are going well. But obviously, we know, and I think many of the listeners of your show know, sometimes things don't go so well. And, what can we do to try to alleviate that as well?
And so I love what you're saying about it's it's what we're receiving from others, but it's also what we're giving.
Right. Right.
Um, yeah.
Um,
Do you want to speak a little more to how this idea of giving, of like the doing of acts of kindness?
Yeah.
Yeah.
So something I found in my research, and I'd be curious to hear your experience with this too, is when it comes to kindness, you have to do something that feels comfortable for you. So maybe it's making a meal for someone that's in your home, or taking care of someone in that way. For your pet, maybe it's a lot of close touching and hugging or petting. You know, for sometimes it's comfortable with family members to give them a big hug if you feel comfortable with that and they're comfortable with that. I know from seeing the data, I've gotten much more intentional about hugging my kids and making sure that I hold that hug a little longer than I think I originally thought was comfortable. So,
Mm,
um, and there's the other thing is, sometimes for some people it's acts of service too, like kind of anticipating, like, maybe someone needs a little help with something that they're working on, or a project or anything like that. So I would say for people listening, like, do something that feels comfortable for you. And the most amazing thing about kindness, and this applies to in your home and other places, is it's not just the receiver of the kindness that benefits, but you actually as the doer benefit as well. And then here's the really wild part that I love: it's also anyone else who observes that kindness.
mm,
So all three parties benefit. And I think that's what's really lovely, because sometimes when you're in a not great situation, you can empower yourself to do a small act of kindness, and that can actually create a positive ripple, or what we call a virtuous circle. Um,
yeah.
yeah, which it feels so small, but the impact is tremendous. And I think that's what's so remarkable about kindness.
Yeah, I love that. It's like I know when I'm feeling down, if I just take the focus off myself and put it on doing something for someone else, like I'm gonna feel better.
Yes, in fact, that's probably my quickest happiness hack for folks is, if you're feeling down, just think of something kind you can do for somebody else. It's someone in your home or outside your home. Maybe it's even a text to a friend to just say, you just popped into my mind and I was thinking about how much I appreciate you.
Mm,
Because I imagine you've been on the receiving end of those notes. It's really nice to get something like that, and it makes the sender feel good as well. So,
yeah.
or they're just sort of infinite ways that you can do something a little nice, which actually kind of brings us to our next area, which is your neighborhood, right? Because that's the other thing when it comes to kindness and the social dimensions of health. Like who's around you? Like, what can you do to make your space and the people who live nearby you just a little bit happier and more connected? Um, yeah, you mentioned too the loneliness. I don't know if that might be something you want to talk about a little bit.
It seemed like the social connection was one of the key components to the healing.
Yes.
Um, but I was also curious. You mentioned like different ways of showing kindness. Some of them are more physical, some of them maybe have eye contact, some of them have less contact. So I'm curious how much the level of contact matters both for the giver and the receiver.
Right. So Laura, I'm so glad you brought that up too, because you mentioned eye contact, right? Which I just saw this really funny poster up on a New York City street that said wanted eye contact. It
Yeah,
was like,
especially now, right? We're all looking down at the phones.
totally. And that's the thing. There actually the World Happiness, or sorry, the World Happiness Report just came out from the group at Oxford and Columbia that put together this report. And one of the things that they found was social connection, of course, really matters to our health and well-being. And one of the ways that we can do that is through shared meals. And
Mm,
so, whether it's in your home or with neighbors or with friends, like being really intentional about getting together with people that you enjoy spending time with and sharing a meal. And it doesn't have to be anything fancy, even just you bring your own something and meet up is a great way to do it. But when you get together, like it's kind of nice if you sort of say, like, put your phone away, or think about just and because there's even studies that if you have your phone out on the table, you're
yeah,
distracted by it. And if it
yeah.
buzzes, forget it, so the thought is, like, intentionally think about putting your phone in your bag and looking up and making eye contact with the people that you're with, whether you're at a table enjoying a meal, if you're having a coffee with a friend, or even if you're just talking, with someone in your home or with a colleague for a moment. Like, making that eye contact has become really precious.
Mm. I'm curious. When we do acts of kindness, and you mentioned like there's the different types, like I was thinking it was almost like you were talking about the love languages in a way, right? There's like acts of service, there's touch. I feel like you're bringing in everything, which is amazing. A lot of different concepts are coming together, right? So one thing that's coming to my mind is because in oh hi in the love languages, like they talk about like you might not like receive love the same way that I do. So I'm curious, and I know this is kind of like a left field question, but like, does it matter the alignment? Like, if I'm cooking you a meal, but you feel love through touch, like, am I still receiving the benefit of having done something for you if I don't get the feeling back from the receiver?
Yes. So the short answer is yes, because so you're right. So the definition of kindness is an act of generosity towards another, expecting nothing in return. So the kindness
Mm,
in itself is a gift. Um, the other thing is, it's so true, because one person's kindness may not be someone else's idea of kindness. I recently heard an example that I liked. It was like, if you were going to do something kind and give someone a trip out of town, that would be wonderful, right? For some people, but maybe for someone who travels all the time, that they actually really just want to be at home. So the other piece of kindness is thinking about, um, you know, thinking about from the other person's perspective what might be meaningful for them, and maybe that means a conversation of finding out what's important to that person, and what they like and
mm.
what they want, or what their love language is.
Mm, yeah. Oh, I love that you define the kindness for us. That's important. You had to back up and do that. So it's when you're doing the act, it's really important not to like secretly want something in in return or hope to benefit in any way.
Yes. And so you're just doing an act of generosity for the sake of an act of generosity. And my theory on it is that you may not always get it back from the person or entity that you're offering the kindness, but it will come back to you in many ways. I think there is a way to do that. And the other thing is, the emotional boost of that, that you get, it carries over and spills over into other interactions that you have during the day, or if other people see that, they may go on to do something kind. I like to give the example. So, I living in New York City, people don't typically make eye contact or smile with people walking down the street, which um, it's funny, because I read this data, and that you actually, if you say hi to people in your neighborhood, you're more likely to have a higher sense of trust in your neighborhood, to feel more comfortable, all these good knock on effects. And so I make a
Yeah.
point sometimes of looking people in the eye and saying hello. And I've noticed that oftentimes when I do that, I get a smile, and I'll sometimes hear them say hello to the person behind me. So it's
That's
sort of
right.
like this small ripple in a way that can create community. So you can think of that and apply it to different situations in your life. But yeah, I would just say go for it. It will not always be, your kindness will not always be returned, and that's to be expected.
Yeah. Yeah, I've been on, in all 3 parts that you described, like, I've been the giver, I've been the receiver, and I've also been the observer, and
Yeah.
it's, like, kicked me into gear, like, then I'm like, "I'm gonna hold that door too." I mean, like, it reminds me.
Oh my gosh, I know. So this just happened to me in the coffee shop this morning because I was standing there and the fellow behind me walked in, and the person at the counter just greeted him with the most warmest welcome and said that somebody said, "How's your day going?" And he said, "Well, it's so much better now that you're here." And he said it in this lovely, welcoming way. And then we were all smiling.
Hmm.
It was this nice moment, and it cost nothing. It took no time, but I think we all left the situation feeling with our moods boosted for sure.
Is there something about, like, starting your day with looking how you can do these acts of kindness that also changes you?
Oh, yeah. So yes, so a couple things around this. So you I love this. When it comes to our minds, we actually start to see what we think about, right? So my favorite example of that is this old thing where it's like, look around your room for everything red. You look around and then you say, okay, name everything yellow you saw. um, because you really see what you're looking for, right? So when you say, all right, I'm going to look for 3 people or 3 actions today that were kind, or something that I'm grateful for, that actually starts you on the process of looking for those things and noticing. And we know when it comes to happiness and well-being, that when you're noticing and present in the moment, our brains are infinitely happier.
Hmm. So is it better to do a lot of little acts of kindness so that you mentioned that little boost that you're getting lots of little boosts rather than like one big act, would you say? Is there any research or data on that?
The world needs as much kindness as it can. So,
Just do it all.
whatever's comfortable for you, whatever's in your means, whatever isn't expending you so much that you're not being kind to
Hmm.
yourself, like go for it. That's what kindness is all about. And there's really fun studies that show that when it comes to social connect, because really kindness comes down to connection, right? So when you're kind to someone else, it's an opportunity to connect with someone else. And we know that
Mhm.
social connection is so good for our health and well-being, and that when we feel disconnected, it's not good at all. In fact, it's as much of a risk factor as smoking 15 cigarettes a day, or other well-known risk factors like heavy alcohol use, being significantly overweight, things like that. So we want to take our social connection seriously, and kindness is just this like fun, easy way that we can just pop it into our day. And it doesn't matter if it's somebody we care about really closely, or if it's what we call in research, weak ties, which are people that, maybe someone you meet at the grocery store, or someone standing in line behind you, or for example, the person behind the register at the coffee shop that I just mentioned. So those are, it turns out all of it benefits our health.
Okay.
So like, don't, what I would say for listeners is, don't dismiss those small acts of kindness, because actually it can really give you a lovely boost. In fact, I'd love to do an exercise if you're up for it.
Oh, yes.
Okay, great. So, if you wanted, and for people listening, if you wanted to just take a second and think about an act of kindness that you saw recently, or did recently, or received recently, any of them, do you have something in mind? Okay, great. Um, and then now think about how you feel in your body when you think about that act of kindness. How would you describe feeling?
Hmm. Like safe, warm, um, seen.
All right. Those are
Yeah.
so important. And so, what's really neat about that, and this is where the science gets so fun, is that when we're having those positive emotions of feeling safe, warm, connected, seen, valued, all those things that people describe with an act of kindness, even a small act of kindness, that's actually creating physiological changes in our body. It's lowering our cortisol levels, it's lowering our blood pressure, it's making us feel our moods boost. There's evidence that people sleep better at night, they're more likely to exercise, eat healthy, like make good decisions too. So it's like this small little thing that has this knock-on effect, which is really fun to think about because we live in a stressful world, and the idea is like, here's
Mm.
something just so simple, totally free, that can make a real difference in our day and our lives.
Yeah, I'm glad you brought us back to that. I wanted to understand more fully, like, what are the changes that are happening through this? We talked about these acts of kindness. You mentioned earlier in the conversation the folks you were seeing in the hospital. That some weren't getting well, some were they having more visitors, or did they report, or the ones who weren't well, that they didn't really have any friends and family, or
That's exactly it. So we know that, and just think of a tough situation you've been in, and it feels so good to have a trusted friend by your side, right? It could be a friend, a family member, somebody, your pet, sometimes, like someone who you feel has your back in some way. And it turns out that that gives us a health boost. And so people are more likely to do better with chronic illnesses that have somebody that's supporting them. There's also, and what's nice about it is there's direct and indirect effects. And so the idea is that, it could be that you feel better, you're calmer, you're more focused, you're better able to problem solve when you have a friend by your side. It also could be that your friend is nudging you, like, hey, go make that appointment, like I'll go with you, like show up.
yeah.
So or let's go for a salad, or do something healthy for ourselves too. So I think we underestimate how much that person by our side makes a difference to our health. But of course it does. Like when we think about it, of course it does.
Hmm. Yeah, I'm thinking like symptomology decreasing, pain decreasing.
In fact, there are these fun studies that I talk about in the rabbit effect, where people who are experiencing pain, but if they hold the hand of somebody that they have a good relationship with, their pain levels decrease, which is pretty remarkable, right? Um,
Yeah.
and also, I think, as a doctor, it gives me pause when I think about how we sometimes do healthcare in our country, because
Mm.
a lot of times people are kind of separated from their loved ones, which is actually quite different than how healthcare is done in other places. Because actually, for having people you trust and know around you, you're more likely to recover quicker, and to not need quite as much time in the hospital, um,
Mm.
which is pretty fun.
How is your research being used to change some of the policies that we have, or are we there yet, or
Gosh, well, I feel I mean, it's interesting. So I wrote The Rabbit Effect right before the pandemic. And then I think we all got, sort of a global lesson in understanding, one, thinking about sort of how we're all interconnected. And then two, really understanding loneliness in a different way. Because I know for many people, the pandemic was and still is to some extent isolating for folks. We've changed how we work, how we interact, everything. Um, and and so because of that, I feel like what's wonderful, and we, had a wonderful Surgeon General, Dr. Vivek Murthy, who really focused in on the importance of loneliness and its impact on mental health. And I've been really grateful to be a part of some of those projects that are really trying to change how we connect with people and how we're mindful about it. Particularly when it comes to our young people, because we know that when you look at sort of studies of loneliness, it's not just sort of older people living by themselves, it's often younger people that feel really lonely and disconnected. And it makes you wonder, like, how could it be that we have all this amazing technology, but yet we still feel so alone?
yeah. And I'm thinking about his work. That's the book I was thinking about when I brought up loneliness. And I'm just thinking about this added aspect that you bring to it, because we all know that we can be side by side with someone as well and not
Yes.
feel like we're with anyone.
Absolutely. So, this is a lot of the work of Dr. Julianne Holt Lundstad, who's just a lovely human being and a wonderful researcher in Utah, who who studied this, and so there's this difference. So we know from the data that there's social isolation, which is physically being alone, like the number of people you see or interact with during the day or talk to during the day, and then there's loneliness, which is kind of a different creature, because it's this idea that it's how connected we feel to the people that we're with, and so it's a subjective feeling versus the
Mm,
objective number of people you have. And we know that both are not great for health, and that we can do something to try to change that. So my favorite example of loneliness is Elvis Presley used to describe being in a crowded room and still feeling lonely. So that's loneliness at its essence. Whereas when it comes to social isolation, there's studies from the UK that show that, there are many adults who live maybe in the country or not, where they're in close proximity to others, and they may not see another person outside of their television for days on end. Um,
mm.
so we can do something about this. That's the thing. We know it's a modifiable health factor, and it's something that each of us can make a difference with the people in our social circles, to improve social health.
Mm. Yeah, I'm just thinking about how the element of like doing the acts of kindness is kind of like that bridge. It's that string that creates all those connections.
Yep. Yeah, exactly. So that's why for me, kindness is really about that connection and that sense of connection. And it's between us as individuals. It's also that sense of connection to perhaps where you go to school or where you work. And then it's to our broader communities as well. So lots of fun ways to implement kindness depending what works for us.
And the workplace we know is we just had an episode on trauma sensitive workplace. The workplace is we spend a huge amount of our day, our lives at work. And I think people no longer want to say, I'm just going to be in pain from 9 to 5 or 8 to 6 or whatever hours people are working any day. Like people, I think since pandemic are like, I want to enjoy my life. It doesn't mean I don't want to work, but I don't want to be at work suffering and in pain.
Oh, absolutely. And I'm so glad you did an episode on that, because we spend a third of our lives at work, and it should be connected to our sense of purpose and well being. And so um, there's really wonderful work that's being done on this. I know, there's folks in England at the World Wellbeing Movement Center that are looking at this, and thinking, how can we make things better for ourselves, that we actually feel supported and cared for in our workplaces. Because here's the absolutely crazy thing is, when you look at the data, the places where people feel supported and cared for are actually the higher performing businesses. So there's lots of interesting data around this, that it's not just the nice thing to do, it's also the smart thing to do for business, to that we feel cared for and supported in all that we do.
Yeah, that was a little we were trying to say too, is like, it's also good for your bottom line. Like,
Oh gosh.
peop yeah.
Yeah, so this was actually just presented. I was just at WAHASU, the World Happiness Summit, and one of the things that was presented, but it was this wonderful work by a professor at Oxford, who actually just wrote a book called Wellbeing in the Workplace. And he starts his talk by saying, I should not have to write this book. But the reality is that, of course, it's good. And he's graphed out, it's sort of like the holy grail of workplace well-being, that you see the workplaces. And he used data from Indeed, so it's a huge sample size. He saw that the
Wow.
workplaces that are kinder, that are more supportive, actually have far superior performance. So you know, it doesn't have to be like that. That's the thing. And I think the other message in that is, you don't have to be the CEO or, in a leadership
Mm.
role to even make a difference. Like, you can just appoint yourself the person that's going to make some kindness and some difference around, your workplace, whether it's virtual or in person, and just go for it in a way that's, of course, respectful. But yeah.
Have you heard of any interesting ways that people are bringing kindness into the
Gosh,
workplace?
it's like infinitely creative. And so let's see, some of the ways that I've heard of, you know, one thing that's really easy is gratitude. I was just talking with someone yesterday who does every, I think it's every quarter with their team, they list out, and it's a shared document, things that other people respect and admire about a colleague. And because it's the kind of things that people think but don't always say. And so
That's right.
it's listed out. And she said she felt so good and so seen and so validated in the work that she does. And she's got a hard job, that she said it made all the difference. Because I think that's the other thing is, it used to be thought that people would show up for money and rewards like that, but it turns out that's only to a certain point, right? Like once we have a place to live and we've fed our family and had a few of our needs met, it only goes so far. But what we do show up for is when we feel like other people are counting on us to show up as our best. And so
Mm.
that's what brings people to work during hard times. I know in the hospital, that's what caused people to show up during the pandemic when it was just really, really tough. So anyway, I think that's what's fun is you can do something that's creative for your workplace, for your colleagues, that feels good, and go for it.
Yeah, I once did a kindness challenge, and it was just so fun thinking of different ways to be kind.
Yeah.
Yeah.
I actually, I'm going to throw in one other one because it's been a game changer. Is sometimes when we have meetings now, we start with people's strengths. So we just
Yeah.
say we name a couple strengths right out of the bat. Like I've noticed that you're always so good talking with so and so, or you're always very respectful, and you make other people feel valued, and whatever it is. You can say it out loud, and it's amazing because it just totally changes the tenor of the meeting, especially if you have something challenging to talk about as part of the
Mm.
meeting. You're coming from it feels like going from like across the table to side by side, looking at what are the challenges.
Mm. Yeah, a couple of things are coming up for me because it's like it's it's an inclination sometimes in work and other places to like just look at what's wrong and try to fix it.
Hmm.
And this is very strengths based.
Yeah,
First let's focusing on what's working.
absolutely.
Um,
I
yeah.
was just in Gallup in DC at they had a symposium on women in the workplace, and I have to say the numbers were pretty dismal in terms of um, how people feel and how they feel recognized. And they very much advocated for a strengths based approach as one of the solutions to try to change things. So it really can make a difference.
Do people ever feel like, oh, like they're just saying this to lead up to like the challenging thing that's coming
The
up?
feedback sandwich, yeah. So
Yeah, the sandwich, the dreaded sandwich.
it's funny. Yeah, no. I think that's the art of it is when other people feel that you really have their best interest at heart, you can talk about difficult things because that's a heart of kindness, whether you're at work or other places. Like you can have those difficult conversations, but they're still respectful and treat the other person with dignity. And they're meant to be helpful, not sort of
Mm,
critical. So
yeah, like we're in this together. It's like we're solving together. Like you gave us that image of beside each other, working on the problem, not working on you.
yeah, or even beyond the problem, like the purpose, right? Like what's our greater
Mm,
purpose that we're working on?
better.
And we are a team on this. So um,
Yeah.
I have to share for your listeners. One of the things since I wrote The Rabbit Effect, the data has just like been increasingly boggling my mind is around how a sense of purpose is so health protective. There are these
Mm.
amazing studies that are done that show really like a stepwise fashion how a higher sense of life purpose, and that can be whatever is important to you, how that can help people live longer and have a longer health span as well. So whatever
Oh,
you're interested in, and it doesn't matter what it is. And I love that every single human being has something like totally wild and different that is, floats their boat. Like go for it because that's actually really important to your health.
oh my gosh. Yeah, I'm a big one of like the meaning, finding meaning, creating meaning. I always say we don't have to find it, we can also create it.
Gosh, I love that so much, Laura, because it's so true. Because you can be in a situation. Actually, I'll go back to my coffee shop. The fellow behind the counter is one of those people that when you walk in, like he is connecting with people in this really powerful way. And he could think like, oh, my job is to just, serve the coffee and that's it. But actually, he's there to create community, it seems like. And he has tapped into some sort of greater sense of purpose that is contagious. Like it's just lovely.
Yeah. Yeah, I bet he knows that, like, I'm here to create community.
Yep.
It's like, something like that is in his mission statement, and when people are really clear on their purpose, it's felt.
Oh, it's so true. It's so true. And it doesn't have to, what I love is it doesn't have to be sort of like what's on the piece of paper as your job title, or it can just be what matters to you. And you can think about that in any situation. So it reminds me of that parable of the bricklayers, sort of like, some people have a job, some people are, in a career, and then other people have a calling. And so the question is,
Mm,
can you create a calling out of what you're doing? And that can be, sometimes it means switching areas, but sometimes it means just being really mindful of the work that you're in.
exactly, exactly. You can change the whole way you do things, without necessarily making a career change, just with a purpose shift.
Yeah, yeah, it's really exciting.
You mentioned increase in longevity. I wonder if we could talk a little bit more about like some of the health benefits. I feel like we did a little, but maybe not as much in depth as people might want to know. Are we like I know you mentioned like this stress goes down, so the cortisol levels go down. Are we like healing faster? Is our immune system better? What are some of the health benefits that we know like we're likely to receive from increased social connection and kindness?
So all of the above. So what I love as a doctor is there are not a lot of side effects to kindness and social support. So absolutely. So we do see boosts in the immune system, which is really nice. There are these crazy studies that show people who have been received hugs, and then were exposed to a flu or cold virus are less likely to get sick, and or they won't be as sick as long if they do get sick. And I think, it's like, well, one, I love that people agreed to that study, but two, that's really amazing, right? That somehow, like, that sense of connection, and in some cases positive physical touch can also be health protective in a way. Um, so there's that. And then we also know that, things like people who feel supported and more relaxed, if you actually like give someone in the lab like a little scrape, they heal faster under different test
Yeah.
conditions. Um, there's, of course, the study that my book, The Rabbit Effect, is named after, which I love. If you'd like, I'm happy to share that study.
Oh, please.
Okay,
Yes.
sure. So, we back in the 70s, we didn't really understand the connection between diet and heart health, and so this wonderful researcher named Dr. Robert Nerum was doing a study by basically feeding rabbits like a very high fat diet, and he thought all the rabbits would have the same health outcomes from the study intervention. And what he found is that one group of rabbits had vastly different, like 60% difference in their health outcomes compared to the other rabbits. And he didn't understand what was going on. He thought there was something wrong with the study. And then they sort of like looked up from the data, and they realized that the person who was taking care of that particular group of rabbits, she was not just feeding the rabbits and sort of doing the standard protocol. She was talking to the rabbits, she was petting the rabbits, she was picking them up, she was totally giving them love and kindness. And what I really love from a science perspective is Dr. Neum thought, like, could it be that somehow this love and kindness is changing these rabbits' biology? And he said, if this is true, this is a big, big story. So he went back, much to his credit, because it was kind of out there at the time. Like, he went back, he redid the whole study and got the same results, and they published it in Science, and it was a big deal. And now, it's like, Laura, we have decades of data that back up that original study that show that actually how we're treated really makes a difference in our biology. So it's really it really means that those moments of kindness and connection are really to be considered, in a way, medicine.
Yeah. Oh, yeah. Oh, that's big to be considered medicine. And even the way that you're telling it in that story, it it brings me back to like the epigenetics, and we talk about that a little bit on the podcast, and trauma. And we know now that trauma can be passed down generations, 3 generations, I think is the latest science. And so I'd be interested to see if like the protective factors of kindness could be passed down, epigenetically, on how the DNA is expressed over those generations as well.
What's interesting, so epigenetics, is this like emerging science that just nobody saw coming, and it's so cool and interesting. And one of the ways we do know that love and kindness can change behavior is through these. They're known as these rat licking studies, where sort of like aggressive rats. Apparently, any rat will mother the pup of another rat. And it used to be thought that behavior was genetic. Like you'd give a sort of aggressive rat a pup to rear, and her rats would be aggressive and continue down. And it was thought, well, that's genetic. But if you swap the pups out, it turns out that a docile rat raising those pups will create, and it's genetically the sort of aggressive rat's pup will turn out to be low anxiety, a docile rat, and that continues on down too. So,
Mm,
which is nice because that actually means it's not totally out of our control, right? Like we used
that's
to
right.
think it was just totally our genes and what we do doesn't matter, but in fact, how we care for other people does. And I actually think how we care for ourselves makes a big difference too. Um,
Mm,
I know there is the data around, ACEs and adverse childhood experiences, which is just so striking. And I think with it, so lovely that you have this show because it's so common, right? Like every other person you pass on the street has had a traumatic experience that would qualify as an ACE. And so I, it's the kind of thing that we also have to think about, well, what can offset that in our own lives? And sometimes it's the kindness we give to ourselves. It's the love we give to other people, especially when it's hard. I think
mm.
that's such the beauty of life and health and love.
Yeah, that was beautiful. I was actually going there. So nice. We're so in tune and aligned with each other, because I wanted to ask you, as women speaking to each other, and we know like sometimes women don't need to be more kind. We need to take better care of ourselves. And if there's any research, or if you want to even speak to your own experience of like the pressure of being kind, or um, if it's too much outward, do some people actually need the instruction to turn that kindness more inward?
I love this question because I think it's really true. And it does feel like there is a gender slant to it sometimes that um, sometimes people can be so giving to others that they forget to give to themselves. And I think actually a good example of this might be, the parent who is always looking after others and then neglects their own healthcare appointments or neglects sort of the things that help them stay healthy and well too, or exercise or things like that. So I would say the sort of warning signs that you've maybe overdone it is if you're feeling drained. So paying
Mm,
attention and getting in tune with your own emotions, it can be very helpful. And I feel like that's a thread of the shows that you've done as well. Uh, and so paying attention to that, because I think also too sometimes when you're so giving for so long, and we see this in healthcare, people are just burned out, like they don't even know what their own feelings are anymore.
exactly.
So how do we practice that? And I'm curious, how do you get in touch with how you're feeling, like what
Oh, well, I check in every morning. I have a sitting practice. I do some meditation, and then I journal. Um, I'm curious back at you about journaling, and if you've incorporated that at all, because it seems like there's an added benefit one could get from keeping track of the nice things that they've done. I think there is some like research on like remembering like the good things, that we can like feel it again.
yeah,
um
yeah,
and really like noting how much we've done, because I think we forget, so for me, I check in, I meditate, and then I usually reflect on meaning and purpose for myself, or um so there's a checking in, then there's a reflection on like how I want to move forward into the day and a bit of writing, and then also like a final meditation to see how I feel after that, and that's
Oh,
kind of my process.
oh, I love that. That's wonderful. And the fact that you've carved out the time to create that meaning in
It's, it's a must because I've learned the hard way.
yeah.
I've learned the hard way, and I'm in a giving field as well. And another thing I try to say to myself is like, and not to be like this sounds kind of cheesy or whatever, but like I'm the product. If I'm not good, like how can I be? I'm not going to be giving good energy. Like there's going to be something in it where I'm quicker, I'm gonna miss something, I'm not gonna see someone exactly, or I'm gonna expect something back. But if I'm like really full, I can be so much better to everyone.
Absolutely. And that's such a beautiful way to say that. It's true. You're just more likely to be kind when you're feeling full yourself. Um,
Yeah.
I think on that note, too, the other thing that's probably one of the kindest things you can do for yourself is to get enough sleep because we know that,
Yeah.
kindness varies throughout the day. But when we are tired, we are typically not our kindest self. So at least I know I am not. So, or hungry. So those are sort of markers to look out for. We also know
That's right.
that when people are rushing, they tend to be less kind. Um, so, those moments that you're able to pause and reflect and slow down, absolutely, you will be kinder coming out of that.
Hmm. Yeah, I love that. Like get those basic needs, like check in at that level, right? I know sometimes if I'm feeling a little on edge, I'll be like, "Are you hungry? Are you
Mhm.
tired?"
And I think the other thing is, I mean, we're humans, right? Like we all kind of mess up on different things. And I think the nice thing is you can also give, if you see someone acting not so kindly, sometimes you can give them a little grace and say, maybe they're tired, maybe they're in a rush, or
Yeah.
something happened to them this morning that they're so upset. So,
Yeah, maybe they're hurting.
yeah,
That's exactly right. And I think if we're rested and in tune, like we're more able to give that grace
absolutely.
than to react.
Yeah.
Yeah. I know we're coming close to the end of the hour, Kelly. Is there can you share a little bit about what you want from our listeners? What's the next step? What can they do to bring your work forward? Advocacy, and of course how to keep in touch with your work and your book and all that.
Oh, sure. So thank you. Well, so one of the things that I has come out of this Rabbit Effect project that's been so delightful is I have started these kindness campfires with friends, and so the kindness campfire is it's a free virtual inclusive gathering where we get together kind of like the campfires of the old days where we share stories about kindness. And it's funny because they're just an hour, but we've had people now from 18 countries join us, and it is so reassuring about the state of the world because you hear these amazing stories of, and sometimes they're just small acts of kindness, but it feels so empowering. So
Mm.
if you'd like, you can go to my website, Kelli Harding MD, and sign up, or it's also our kind of club as well. And if you Google that, you'll find it. Um, and then the other thing is, I would just encourage you to, after listening to this episode, I challenge you to go out and do a small act of kindness. Maybe it's a note of gratitude to someone. Maybe it's saying thank you. Maybe it's a smile, eye contact, whatever it is. Make it fun and let us know how it goes. I'm on LinkedIn and social media, Kelli Harding MD. Thank you so much. And I'm so grateful for the work you're doing and making people feel less alone. Because I think that's the hardest part is when you feel like you're going through something by yourself, but in no way is anybody going through anything alone. There are tons of people out there that can support you.
What a beautiful message. I hope listeners will really take you up on that and also share with you how the episode has impacted them, like what they did, because I want you to receive all that kindness back to you.
I would love that. I have to say that is the greatest joy of studying kindness is all the stories of kindness that I get to hear. It's delightful, and I'd love to share that with you.
Well, Kelly, it's been wonderful. Your smile is infectious. I'll encourage people to go on the YouTube to see that your bright smile. And You've definitely my cheeks are hurting just smiling at you this whole hour, so thank you for spreading your kindness this way, and, your work is just so much appreciated.
Oh, Laura, thank you so much. It's been so my pleasure.